What we need to do is ask good questions and then sit back and listen and learn how to respond. So that's part of it when I talk about soft skills, soft communication skills. People spend a lot of their time looking at their devices, communicating on their devices with emojis. And then we expect those same people to sit in our practice and look face to face, eye to eye with a patient and have a conversation about 5,000, 10,000, 15,000 treatment plan. It's a lot to expect from somebody that isn't
Well,
used
not
to
well,
doing
not
that
only
on a
that,
regular
but just
basis, let alone training.
not only that, but you also they don't always understand the connection of why they should do it, right? So a lot of times people are getting explained, hey, you need this treatment done, but it doesn't hurt, right? So there's a big disconnect there. So how do you so if you're dealing with these people who on both sides, you know, they're used to texting and emojis, to your point, how do you bridge that? What's the bridge to solve that problem?
Well, it's training. It's several things. Um, we know from many, many, many studies that people make buying decisions based on emotion,
Hmm.
and then they justify it with logic. Everything from healthcare to cars to clothes, whatever, you name it. So if we make decisions based on emotion and then our patients come in and we just give them a lot of clinical reasons as to why they need this treatment, we're not really appealing to their emotions. So I kind of call it selling from the heart. We've got to be in relationship with our patients, and we need to understand what their values are. So I have a process of teaching people how to ask good open-ended values questions, because here's the thing, Gary. I can take two patients that both need a crown on the exact same tooth in the exact same quadrant for the exact same reason, and based on their value, whether they're cosmetically oriented, whether they're fear or pain oriented, whatever their value are, I'm going to present that very differently to those two patients.
Mm.
So how does a clinician learn that? And it's through, there's that old saying, if you want to sell, ask, don't tell. And I'm afraid with our patient education, that's what we're doing. We're dumping a lot of information on our patients when they're not ready to hear it yet. I'm not saying it doesn't have any value. It does.
Yeah.
I'm just saying that it needs to come at the right time. Good education is not the filling of a bucket. And that's what we do. We fill our patient's bucket till it's overflowing. And then if we get that deer in the headlight look like they don't quite get it, we fill it some more and we give them some more information
Yeah.
until they're completely in overwhelm, when what we need to do is ask good questions and then sit back and listen and learn how to respond.